name is Oluwatosin. I'm a student of William Patterson University. I'm in the class of Advanced Health Assessment, and I'm here to do a video on the head, eye, ear, nose, and throat assessment, respiratory assessment, and cardiovascular assessment. With me here today is Miss Kemisha. I'll be running the assessment on her, and she has consented, to do the video with me, right, Miss Kemisha? Okay, thank you. So I'm gonna start with the general survey, starting with the appearance. She's well groomed. She's well groomed, and she dressed appropriate for the occasion. And as per the mood, her mood is calm. She's cooperative. She's alert and oriented ×4. She's in no apparent distress. Her skin color is intact. The skin is warm to touch, is dry, and is appropriate to the ethnicity. Next, we'll move to the head and the face. So looking at the head, our head is symmetrical, it's round. Now I'm gonna palpate the scalp to see if there's any lesion, depression, masses. Are you in any form of pain?
No.
Okay. So by palpating the scalp, I see that there's no lesion, there's no masses, there's no depression on the face, on the scalp, and the hair is evenly distributed. So inspecting the face, I could see that the face is symmetrical. I can see that the face is symmetrical. So we're moving to check for cranial 5 and 7. So I'm gonna ask you to raise your eyebrow. Good. I'm gonna ask you to frown, and I'm gonna ask you to smile. Good. I can see that the cranial nerve 5 and 7 is intact. I'm also gonna ask you to close your eyes. So I'm putting my fingers on your eye. So you try to open it against resistance. All right. That shows your cranial nerve 5 and 7 are intact. Now I'm going to check for facial sensation, which is cranial nerve 5. So I don't know if you are feeling any sensation on your face.
Yes.
This is the left hand side. Did you feel any sensation?
Yes, I did.
Did you feel any sensation on the right hand side?
Yes, I
So
did.
your cranial nerve 5 is intact. Now we're moving to masseter and temporal muscles. So I'm going to palpate your masseter. Can you open your mouth? Okay, I can see there's no click, there's no dislocation. Now I'm going to palpate your tempora. Can you clench your teeth? Okay. So I can see that the masseter and the temporal muscles, they are intact. Now I'm moving to the eyes, and I'm going to check for corneal light reflex, the Hitchcock light, the Hitchcock test. Now I'm going to use my pen light, and I'll point it directly on your eyes. I see that it's symmetrical. There's no deviation. The pupils remain unchanged. That's the Hitchcock test, so it's intact. Now we're gonna do the cover and uncover test. Please, can you use your hand to cover the left side of the eye, and then you take it off and use the other hand to cover the right side of your eye. Okay. We can see that the pupils are not trying to fix itself with that test, which is the cover and uncover test. Now we see that your vision is intact. Now we're going to do the extraocular movement. So what we do here, I'm going to move my fingers around to check if your cranial nerve 3, 4, 6 is intact. So I'll point to your nose. So you're gonna follow the direction of my hands with your eyes. Okay, go 6 is intact. Now I'm moving to eyelashes and eyebrow. I'm gonna inspect. I see that the eyebrow, they are appropriate, no scars, it's normal findings, it's symmetrical, no discharge. Now the next thing we'll move to lacrimal apparatus and conjunctiva. So I'm gonna move my fingers first to the left. So you're gonna follow the movement of my finger with your eyes. Good. And to the right, you're gonna follow the movement of my finger. Okay, that's good. So the lacrimal apparatus is intact, and then I'm going to palpate your lacrimal apparatus to make sure it's intact. Okay, I see that there's no swelling, there's no drainage, and there's no form of lesion. So now we'll move to pupil dilation, which is the pearler. And with this test, I'm going to use the pen light. Okay. So with this pupil dilation, we can see that the pupils are equal. They are round, reactive to light, and there is accommodation is noted. So the next thing we'll move to is the fundoscopic assessment, which we're gonna assess the red reflex, the optic disc, and the retina. So what I will do here is to switch off the light and use my pen light to look into your eyes. So from this test, I can see that the red reflex, the optic disc, and the retina are intact. I'm gonna inspect the ears now. So this is the right side of the ears. I'm checking for any the ear is symmetrical. There is no inflammation. Are you having any pain?
No.
I'm pressing on the triggers. Are you having any pain?
No.
Okay. I also want to use the otoscope to check the ear canals. I can see that there is no wax. I can see some here, no inflammation, no drainage. So now I'm moving to the right side of the ear. On inspection, there is no swelling, no bruising. The ear is symmetrical. Are you having any pain?
No, no pain.
I'm pressing on the tragus. Are you having any pain?
No pain.
Now I'm going to look at the ear canal. I can see a little wax. Is expected though. I can see some here. No drainage, no inflammation. Now I'm going to do the Weber test. Are you hearing the sound?
Yes, I am.
Okay, good. Now to the Ryan test. Tell me when this you can't hear the sound anymore. Has it stopped?
Stop.
Okay, good. Has it stopped?
Stop.
Okay. Now I'm going to. Have you stopped hearing the sound?
Yes, stop.
Okay. Has it stopped?
Stop.
Okay. So that means his hearing is very good. Now I'm moving on to the nose. The nose is symmetrical. is midline. There's no deviation to the right or to the left. I'm gonna inspect, okay, the septum is in place. There's no swollenness, there's no tenderness. I'm gonna inspect with the otoscope. I'm gonna look at the nasal cavity. Please, can you put your, I'll inspect the left side. I can see that there's some here, no drainage, no inflammation, it's pink. The same thing goes for the right side of the nose ridge. I could see some here, it's pink. Some nasal here, no inflammation. Now I'm moving on to the mouth. Okay, so now I'm checking for sinuses. We have the maxillary. You see that is intact, and then the frontal is intact. Now I'm going to put this close to your nose and tell me what it smells like. Okay, good. So this cranial nerve 1 is intact. Now I'm moving to the mouth. The lips is symmetrical. There's no deviation to the right or left. The lips are pink and a little bit moist. So you're gonna open your mouth for me. Can you open your mouth for me, please? Okay, the tongue is midline, is symmetrical, is pink. I can see the gums. There is no exudate, there is no inflammation. Can you open it? I can see the tonsil is pink. There is no swelling, there is no exudate. The teeth are well placed. Now I'm going to check for gag reflex. Okay, the gag reflex is intact. That's cranial nerve 9 and 10, which is the gag reflex, is intact. Now I'm going to check for swallowing. Try to swallow something while I feel for you. Are you having any pain?
No.
Any difficulty?
No.
Okay, so she has a good difficulty in swallowing, so the swallowing is good. That is cranial nerve 12 is intact. Now I'm moving on to taste. I'm gonna give you this too. So what does it taste like?
Mint.
Okay. So that's cranial nerve 7 and 9 is intact because you could actually taste what it is. Thank you. Node region. And now I'm gonna palpate the lymph nodes. It's non-palpable. I'm gonna palpate the carotid one side at a time. Okay, no bruit, no trail. Now I'm gonna palpate the thyroid. No bruit, no trail. Can you swallow for me? Now I'm gonna auscultate. I'm auscultating. Now I'm going to auscultate the lymph nodes. No bruit, no trail. I'm going to auscultate the carotid one at a time. Okay, no bruit, no trail. I'm going to auscultate the thyroid. Okay, no break. Now I'm going to assess for cranial nerve 11. So can you put your hands on your, can you put your hands on your shoulder and breathe, deep breathe out. Okay, I can see that there's chest expansion. Now you can put your hands down. I'm going to put my hands on your shoulder, so you're gonna try to like I'm trying to push the shoulder down, so you're gonna try to resist. Okay, so from this test I can see that your cranial nerve 11 is intact. So I'm going to examine your chest, the exterior. I see that there is no scar, there is no lesion. So I made a mistake. I'm going to check for lung sound. Oh, what am I doing? Okay, that's the anterior. The lung sounds are clear on the anterior region. Can you turn sideways so I can check for lung sound on the posterior region of the posterior region? Okay. Take a deep breath. In, out. In, out. In, in. Okay. I can see that the lung sounds are clear. There is no adventitious sounds, no ronchi, no wheezing, no crackles. Now we're moving on to tactile fremators. I'm going to palpate. I'm going to percuss. I'm also going to percuss the posterior region. From this percussing of the posterior region, there is no bruit, no trip, no crepitus. It's normal. Now I'm going to assess the respiratory rate. Is regular, and your respiratory rate is 18. Now I'm going to check for jugular distension. Can you turn your face to that side? No jugular distension seen or noted. Now I'm going to assess for heart sound now, the heart sound. So can you lay into our heart sound? Okay. This is the aortic, which is the second upper right intercostal space. pulmonic, which is the second left second upper left intercostal space. This is the abs point, which is the third left intercostal. Okay. Now I'm checking for the tricuspid valve, which is on the lower left intercostal space. And now I'm checking for the mitral, which is on the mid-clavicular line. Is a point of maximal impulse where we can hear the S1 and S2 sound. Now I'm going to palpate the pulses on the lower and upper extremity, starting with the medial. There's pulse 2+ is bounding, and I can palpate the pulse on the medial on both sides is 2+. I'm going to palpate the femoral vein on the left and on the right. It's 2+. I'm also going to palpate the popliteal vein. It's 2+ on both sides. The tibia pulse on the left side. I can feel the pulse is 2+, and the dorsalis pedis. I can feel it on both sides. It's 2+. Thank you.